There aren't many days that go by when I don't talk about Rosie. Partly because my 15-year-old is called that, but partly because I think what you're doing is wonderful, and it makes me really happy that this program exists when there are people like you on it. So I'm going to let you tell everyone about the truly inspiring thing that Rosie does.
You can tell I'm not very techy. My name's Rosie. I'm a junior clinical fellow, so a junior doctor. I work in an A&E department at King's College Hospital in London. Very, very busy. Finished nights this morning, so sorry if I'm glassy-eyed. And I want to tell you about my training program called VITA, Victim Identification and Trafficking Awareness. Something I set up as a third-year medical student, so I've been running it for the past 5 years. There's a lot that's happened in the past 5 years. So I just want to start by giving you a bit of context. So a few months back, there's a 7 or 8 hour wait in the emergency department. I'm really tired, it's very short-staffed, it's busy and chaotic and noisy, and there's a lot going on. And I pick up the notes to see the next patient on the list, 17-year-old female, and she has abdominal pain. Her observations are all stable, and she's apyrexic, she doesn't have a fever. And the triage nurse has noted on the notes that she's accompanied by her husband. She's 17, she's accompanied by her husband, and he will be translating on her behalf, and she's from Romania. So red flags are waving already in my head. I'm getting ready to use all safeguarding tools in my toolbox. But what sort of questions can I ask? How do I get the husband out of the room without raising his concern or alarm or suspicions, so that I can speak to the patient on her own? How can I get a translator involved? All these sorts of questions would be whizzing through my head. So that's sort of the basis, that's the context of the story. So trafficking is the movement of people by force, fraud, coercion or deception with the aim of exploiting them. It comes under the umbrella of modern day slavery. And why is this important? So the Home Office in 2012-2013 said that between 10 and 13,000 victims of modern slavery are living and working in the UK. Now the Global Slavery Index estimated this was more like 136,000. So we have no idea, it's a very hidden world, but it's a massive problem in this country. It is in the cities, in the countryside, it's everywhere. And victims of modern slavery are presenting in healthcare settings. So many retrospective studies from all across the world have consistently showed a significant proportion of the survivors in their sample sizes have come in contact with healthcare services whilst they were in slavery. So the range is broad because the sample sizes were small, but they're consistently significant. So that's the basis of my training. So in 2015, the Protect Report was published, and this was an extensive piece of research funded by the Department of Health, and it looked at what trafficking is looking like in the UK, and especially relating to healthcare. So a large part of that was a survey of 782 NHS healthcare professionals from across England, and 1 in 8 healthcare professionals said they knew or strongly suspected that they had come in contact with someone who's been trafficked. And in maternity services, that's 1 in 5. So I know I have. And 1 in 8 overall, without any training, know they've come in contact with someone. And yet 8 in 10 felt they haven't had enough training. And 95% were unaware of the scale of trafficking in the UK. So this is a very significant gap. Victims are presenting in health services, and healthcare professionals don't know what to do about it. So when I was a third-year medical student, before all of this data had come out and been published, I recognised that there was this massive gap. So I developed a training programme. I did it with the support of a local anti-trafficking charity, and essentially it covered mainly what is human trafficking and modern slavery, and what is its impact on health, so what sort of health presentations might someone come in with. How might you identify a potential victim of trafficking? So what sort of red flags you can sort of use, and what kind of questions could you say to elicit clues? And then most importantly, what do you do during the consultation? How do you act safely and appropriately with a person who's very, very high risk of danger? and then how to seek help and referral. And you can see on the right is my traffic acronym, which is a simple tool. I just consolidated all of the red flags, so that's part of the training. So during this project, between 2 to 3 weeks, I, as a third-year medical student, had barely seen a patient before, ready to go out into the world and train fully experienced, fully trained healthcare professionals, very audacious, and was slightly expecting that only maybe a couple of GPs would oblige me. So in about a 2-week period, I was blown away by the demand and actually was invited to train 8 general practices in a sexual health clinic. So for all the trainees, there were 57 in total, I asked them to fill out a pre- and a post-course self-assessment form of their own knowledge and confidence in various categories on a 10-point scale. And then I collected this and gathered that, very crudely, there is an improvement in their knowledge and confidence from this training. I then presented it at the Protect National Stakeholders Workshop, which was a massive event in 2015, with all the key stakeholders across the nation, the National Crime Agency, the Department of Health, Education England, and NHS England were all there. And so there was a bit of traction from that. So since then, just gives you an example of what we've been doing since then. In February 2016, you can see I ran a workshop at a national conference in Bristol, and there was a medical student who was really keen to get involved. So I trained him up via training Leeds Medical School and Sheffield Medical School, and so together we've been quite prolific in what we've been doing. We've been very busy alongside full-time medical education and full-time junior doctoring. So in total, we've trained 1,100 plus healthcare professionals, mainly doctors, and we've collected the data, and this just shows that in each of the categories there's a statistically significant improvement in their self-reported knowledge and confidence. So, and yet I'm not quite satisfied, because I think there's something really important about interactive training. It's one thing to learn a lot of information and possibly eye-opening, very interesting information. It's another thing feeling really equipped to know what to do when I've got a 7-hour wait, I'm the only doctor in minors, and I've got a young person in front of me, and I'm really concerned that something's going on, yet as an accompanying person. What do I do? That person's in front of me. It's a completely different set of training. So I developed simulation scenarios with actors, and that would give the trainees the ability to practice role-playing these challenging consultations, putting their skills into practice. So I ran this at Guy's and St Thomas's with 40 of their GP trainees, and the feedback was amazing. One of the GP registrars was saying, I've never felt, from any safeguarding training, that I've known what to do when a patient's sitting in front of me. So from this, I decided actually, well, simulation training with actors is fantastic. It's the sort of kind of training, but actually it's expensive. Not everywhere can provide rooms and facilitators and actors. So I made my first video last December, and I trialled it at my hospital with my junior doctors in the A&E department I work with, and the feedback again was amazing. And one of the doctors just as she was getting up, just said, well, I'm going to do a few things differently when I go back downstairs then. So this training is really exciting because it's bringing about real practical change to your consultation skills. I've never had that from safeguarding training before. Has anyone who's a clinician here ever felt they've been prepared by the safeguarding training they've had? Not me. So, not very official, but this is just a little look into my mind of what's been going on with Vita. Not technical at all, but pen and paper. Essentially, my vision for Vita is to transform the way that we safeguard in healthcare, particularly for the most vulnerable and trafficked people. So the way we do that is through the main values being patient-focused, trauma-informed, sustainable, and evidence-based. And so the way that I go about that is my 3-pronged approach. Training we've talked about already, so I'm making new videos, making new simulation scenarios, and working with specialists who are also specialists in the field, specifically in trafficking, to develop this for paediatrics, obs and gynae. And then I've also very excitingly been in conversation with Health Education England, who are keen to commission a Vita Pan London conference this autumn. And also they are keen to commission the training with actors and simulation for the GP training schemes and emergency departments in South London. So that's really exciting. Evidence-based wise, I won't go into that too much, but it's really important for me that Vita contributes to the growing evidence base in this area, but also that we continually evaluate the outcomes of the training that we've been doing. And then the third prong is advocacy and system change, and this could be my full-time job plus, if you forget that I'm just part-timing this. It's really important for me that Vita becomes integrated with the existing systems and structures in the country, otherwise it won't be sustainable. So I do that by networks, really. So for example, tomorrow I'm a new member of and speaking at the NHS England Modern Slavery Network. So it's a newer network of healthcare professionals who are pushing the national agenda in this area. But also, I'm a member of the Modern Slavery Strategy and Implementation Group, which directly advises the Home Office policy. Politics-wise, I think it's important to get political movement and political agenda. So I'm working with the Modern Slavery All-Party Parliamentary Group, trying to push this agenda from a healthcare point of view, and also have the support of a Conservative MP and a Tory and a Labour MP who want to make a political media campaign on this as well. And finally, I want to draw your attention to the Vita Modern Slavery Health Network. So this is a growing network. We actually really launched on social media a couple of weeks ago. But it's a growing network of individuals, healthcare professionals who are really invested in the healthcare response to modern slavery. It's been a forgotten area of tackling modern slavery in this country. And so it's a place where anyone can get involved and just keep up to date, connect with others and share their ideas and thoughts. And it's already got a lot of the key stakeholders as members of that online. So if you are interested, then follow on Twitter, Vita_MSHN, and then contact me, one of those things. Thank you.
What did I tell you? Can you believe that safeguarding training in the National Health Service didn't include educating our staff when someone has been forced to come in? It's something, and I want that taken up all across the country, and I won't stop until it is, and I know you won't either. Has anyone got any questions they'd like to ask? Yeah, go.
Yeah, I know you focus mainly on the UK, but do you have international plans as well?
Well, actually, a lot of my inspirations come from the States. The States have really been pioneering in this area. They have an international network called Heal Trafficking, and it's absolutely massive, but mainly Americans. And it's the frontline research, frontline services. They have hospitals, they have specialty departments for trauma, sexual trauma, and abuse. I mean, it's amazing and way beyond anything we've got in this country. I had a patient who came in who had to sit on chairs for 7 hours after being sexually assaulted, just because we couldn't do anything about it. There's nothing we could have done. And so the states they're all over this, and so I've been connecting with them. I didn't want to replicate what they do. HEAL is a network, so I just wanted one where actually it was UK focused without needing the use of academic element.
I think there's a group in the States called the Train Chain or something like that, which is mainly focused on pediatric slavery as well.
Right, okay.
Interesting group.
All across the States.
I don't know about all
Specific.
Yep.
Hello, thank you so much. My name is Nicole. I run Spark to Difference, which is an organisation bringing humanity back into care. I've been working with migrant and emerging communities in West London, and the Metropolitan Police reached out to me to ask them to go on raids with trafficked women, and I had no idea how to interact with people. I wonder if there's an opportunity to do partnership working with the police.
I think there is. I think what is important is to do what I have expertise in. Actually, there's so much emphasis from the police side. So, I mean, in the modern slavery strategy and implementation group, from the government point of view, from the politician point of view, the police is actually their focus, which is great. And they've got a long way to go, but it depends on which sort of officers have been trained. Some services have been quite extensively trained, so when they go on raise, they know exactly what they need to do. Some haven't, it's very geography dependent. I think the government's focus actually is from the point of identification and then through the referral system that exists and looking after someone who's been identified. It's actually a really poor system, really poor relative to other countries. But actually my focus is on pre-identification. So on someone just creating an environment within the health service where someone is safe to disclose if they choose to what's going on, but not forcing them to and meeting their clinical needs and being completely independent from their system is pretty poor.
So with my filmmaker hat on, if you wanted to have a conversation afterwards about interactive VR videos in terms of simulating,
Yeah.
come talk would be great.
That'd be great.
Helpful.
Thank you.
Brilliant, Rosie. Thank you very much for the seats.